Hello, and welcome to In Service of Health, brought to you by the Public Health Accreditation Board, FAB. This is the podcast that brings healthcare and public health leaders together to inspire new thinking for healthier populations. In this episode, I was thrilled to sit down with Ramsey Alwin, President and CEO of the National Council on Aging. Ramsey and I have worked together on projects over the years, and I've always just been so impressed by her tireless advocacy and thoughtfulness when it comes to aging, and specifically aging well. She is absolutely a thought leader, she's a policy advocate, and she's really been leading a nationwide movement to ensure all Americans can age with health and economic well-being. In this episode, Ramsey and I sit down to talk about the intersection of health, wealth, and policy, the great work and services available on the ground, and the importance of supporting caregivers. I hope you enjoy the episode. Welcome, Ramsey. Thank you so much for joining us on the show.
Well, thank you for having me.
Yeah, again, we've worked together for several years. I'm just a fan of your work. But why don't we start by having you tell us what really motivates you to be in this space and to do this work?
Well, thanks so much for having me and thanks for asking. I grew up in a small fishing town in Maine, and I very much so saw the haves and the have-nots on display in my hometown. I grew up on one side of the tracks as the daughter of a lobster fisherman and a waitress. And then there were beachfront properties with incredible wealth and incredible opportunity. And in my own family, I saw how that disparity, that difference really played out. My father had heart troubles early on as a lobster fisherman. That was a hard life. And you add to it medical bills with very limited health insurance coverage. He struggled. He struggled to make ends meet. He struggled to be able to pay his medical bills, various heart attacks and heart surgeries. And really, he experienced the challenges of trying to navigate his own ability to provide for his family, take care of his own health. The system really was not there for him, despite working hard, playing by the rules. He constantly came up short, and it added to his physical health issues, mental health, and stress issues on top of it. In the end, he passed away just a few months shy of early eligibility for Social Security, which could have helped. But I really believe it wasn't just the physical health issues, but it was the stress of the medical debt that really shaved a few years off his life ultimately. And although that's our family story, I know it's not unique. It's far more universal. There are many, many stories of individuals that work hard, they play by the rules, and then when they inevitably have a challenge, it's really difficult to navigate it on your own. And so for me, I see aging well and everyone's opportunity to age well really as an issue of justice, economic justice and social justice.
Thank you so much for sharing that personal, very personal story. You've had an amazing career. Talk about a little bit more about why you chose the aging community in particular and this current role, and some of the stories and experiences that you've been able to witness in your work that really informs your approach at NCOA.
Sure. Well, my professional career has evolved from issues squarely about anti-poverty and economic justice to ultimately looking at the issues through a gender lens. And then that led me to an aging lens because all of these challenges, the economic insecurity, the health issues we experience, all of it compounds in old age. When really we need supports and services in order to stay independent and stay healthy. And so that's what brought me into the aging field was an economic justice career that led from anti-poverty to women's issues to aging issues. And what brings me to NCOA, and actually this is my second time, I'm back for my second tour at NCOA, is that we're squarely focused on older adults struggling with their health and economic security in old age. And for over 75 years, NCOA has been focused on working with the community-based organizations that are really, really deeply tied into their communities. Both the beautiful opportunities of age and wisdom and experience being brought to those communities, as well as the challenges some individuals face as they navigate old age. And working with those community-based organizations, the area agencies on aging, the councils on aging, the senior centers, the other community and faith-based organizations, really informs how we approach all of our work, our advocacy, our programmatic design, our education. There are so many stories of individuals that come to those community-based organizations looking for help, and there's so much we can learn. And there are two in particular that come to mind that really fuel the fire in my belly when it comes to this work. And one is Mary. So Mary was 79 years old when she came to one of our partners looking for help. So Mary had done all the right things. She worked hard, played by the rules, saved, had a nest egg later in life, but she got caught up in a romance scam online. All of her dollars were taken out of her accounts, no way to recoup them, and Social Security was not enough. And so at 79 years old, Mary comes to one of our partners asking for help finding a job. And we do lead a job training and job placement program at the National Council on Aging, and we partner with different community-based organizations on that work. And this organization helped really sharpen her skills and increase her confidence, really helped her get comfortable back in a work setting after being out for so many years, and was ultimately able to secure her permanent employment. And so with a renewed confidence, with a peer network through work, she then came to terms with the fact that she had been scammed, shared that news finally with the authorities, and they were able to get the bad guy, only to find out that he had scammed others as well. But she never recouped her dollars, but her confidence and her sense of self was so much greater. And she continues to work at that organization and enjoy the time that she has on the job. And so we learn about some of those experiences, and they really inform our advocacy and our efforts to make sure those job training programs are more widely available, that we educate on the prevalence of scams and financial exploitation and how any of us can be victim to it. So Mary's story always comes to mind because there are so many facets of it, where there's an opportunity for advocacy and public policy. Another story that comes to mind is a gentleman from Vermont who contacted one of our local partners to get help with a Medicaid application. It's pretty overwhelming and quite lengthy to fill out a Medicaid application. And guess what? You often do it under really stressful circumstances. When you are not in good health, when you've got a lot on your mind. And come to find out, when the caseworker started to unpackage his story, he had a broken vertebra after slipping in the shower, very little mobility. His wife was dealing with some health issues. He also had cancer. So it was clear that he had a variety of issues that he was navigating, and he needed more than just the Medicaid application. So the caseworker was able to connect him, not just with Medicaid, but SNAP, a food assistance program, a home energy assistance program, the low income home energy assistance program, or LIHEAP, a home repair service that could address the bathroom safety issues and an exterior ramp to make his home more accessible, as well as getting him enrolled in home delivered meals. So his story just always reminds me of the range of needs people have and how often they don't even know about the help that's out there. When they don't know that the help is out there, and when they maybe try to navigate the issues themselves, it's extremely costly. And so a lot of our work with community-based organizations is to help individuals get connected to, get enrolled in the programs that can help them remain independent and remain healthy. And we find every year $30 billion worth of assistance programs get left on the table. So we work with community-based organizations to try to help enroll people. We also offer a free online tool, benefitscheckup.org. Benefitscheckup.org is a website, completely free, anonymous, and it can identify hundreds to thousands of dollars worth of support that can go a really long way in helping people get their needs met.
Wow, thank you for sharing those stories. And also, it also to me says there's so many resources that are available. And whether you're working in an emergency department, in a hospital, a health department, we also need to make sure we are connecting people to those services when they are coming through our doors. So thank you for that. Thank you for sharing. I also love how I think you kind of touched on this. Aging in and of itself is not necessarily a bad thing. It is good to age, and we want people to age well. So with that, why don't we get into aging? Maybe you can describe for us, just define, like people talk about the aging population. There's one statistic that the aging population is expected to grow from 58 million in 2022 to 82 million people, a 42% increase by the year 2050. To talk a bit about like what does that actually mean? Like what does it mean to be an aging population? Aren't we all aging from the day we're born?
Exactly, exactly. We all are aging from our first breath, and it's an incredible gift to be able to age. But we all want to age well. We want to age with our health, with our independence, on our own terms. And so it's actually a global phenomenon that we have an increase in longevity. And that's thanks to so many great advancements in public health,
Yeah.
in medical and technological advancements. I believe our greatest challenge now is to make sure those are years of good health, those are years of independence, those are years on our own terms. And there's still a lot that needs to be done in that regard. And I would be remiss if I didn't acknowledge there are still major demographic divides in terms of actual life expectancy and health span. We've done some research with the University of Massachusetts Boston's Gerontology Institute, released it just several weeks ago, and it looked at it from a socioeconomic lens. And the reality is that older adults with $20,000 or less in income die 9 years sooner than their peers that are fortunate enough to have 120,000 or more in income. And so you see variation by socioeconomic status, by race and ethnicity, by gender, and we have some real work to do in the United States to close that gap, not just in life expectancy, but also health span, those quality of years.
Absolutely. And thank you for sharing that. Let's touch on public health. So we are the Public Health Accreditation Board. There's over 450 health departments who are accredited by us, FAB. Talk to our public health audience, right? Why is the aging population so important to those working in public health? And how should we be thinking about the intersection between the aging population and working in public health?
Well, first and foremost, thank you all. Public health protects all of us. It protects all of our health. It helps everyone stay healthy. It helps us ensure that we don't just age well, but we live well. And for us at the National Council on Aging, there are two critical public health issues that we focus on in terms of our aging experience. And those are falls and chronic diseases.
Yep.
So as we age, there are some pretty eye-popping statistics to keep in mind. For instance, 1 in 4 Americans 65 plus falls each year. That's over 14 million. And there's a real cost to that. There's a cost in terms of those injuries and the quality of life. There are fatalities. There are costs to Medicare and Medicaid, actually to a tune of $80 billion. And falls are not an inevitable part of aging. There are programs that are evidence-based that can help. So that's a large body of work that we advance. The other body of work, I think, of note to the public health sector in particular, of course, is chronic diseases. So 80% of us, as we age, are likely to age with 2 or more chronic conditions. Think diabetes plus hypertension, diabetes plus obesity. We've actually done some research, again, with our partners at the University of Massachusetts Boston's Gerontology Institute to quantify the cost of those chronic conditions, to look at the treatment costs, the non-medical treatment costs, and the loss to wages. And it is billions of dollars. Again, these chronic conditions are not an inevitable part of aging, however, and there are proven programs that can help people either prevent or better manage their chronic conditions. And that's the work we've been doing for decades. We serve as the National Resource Center to prevent falls and the National Resource Center for chronic disease self-management in collaboration with our federal partners at the Department of Health and Human Services. We accredit the evidence-based, community-based programs that
Yeah.
are available through the Aging Network. And I think there's a real opportunity to bridge the public health sector and the Aging Network to make sure everyone is benefiting from these evidence-based programs.
Can you tell us a little bit more about what's one program that you've seen really work well in a health department, in a state, municipality, that really gets at how the aging community and those services connect with health departments?
Well, you make me just pick one of many
I'm open, that's
favorites.
fine.
But just to get started, I mean, if I had a magic wand and I
Yeah.
was in a position to ensure the programs we know work were made available in every zip code, which is just not the case right now,
Yeah.
I would probably pick the chronic disease self-management program. It's an
Mhm.
evidence-based, community-based program that's administered in a variety of settings, public health settings, community-based settings. It's a peer-led group counseling effort that focuses on diet, nutrition, exercise, mindfulness. There's a peer-to-peer accountability component of the chronic disease self-management program, and it's been through rigorous evaluation demonstrating it has the potential to bend the curve on one's symptoms and improve their health outcomes, and has had lasting results. And
Yeah.
so I would like to see that program made available in every community. The
Yep.
challenge is it isn't. Currently, it's
Yeah.
supported by the Older Americans Act funding,
Yeah.
less than $20 million to make the program available in as many communities as possible. And with that being the case, dollars that are approved by Congress that are then allocated by the Department of Health and Human Services go to the state units on aging, where they then determine if they have the resources to then make those programs available in communities. So for so many, it really depends on their zip code, whether or not they have access to an evidence-based program.
Yeah, thank you for that. And you're touching on an important point as well, I think, which is oftentimes we have data, we have evidence-based programs that exist. These diseases, the incidence of falls, it's actually preventable. All we need to do is make sure people have access to these programs. And the hard part for us working in public health is that we all know that prevention is much cheaper than the actual disease or the fall and the injuries. Again, I'm an ER doc. I see people with falls all the time. It's just a matter of how can we make sure everyone has access to these services and programs. So thank you for that. Let's go back and touch on what you talked about in this intersection between health and wealth, right? You've done a lot of work and advocacy in this space. How can US health and social policies be improved to really better reflect the true cost of aging for all people, wherever you live, whatever you look like, whoever you are? How can we really make sure those social and health policies really align with what's needed?
Well, I really appreciate the recognition that health and wealth, they're two sides of the same coin. They really are interrelated. And when we look at issues and trends among older adults in particular, it plays out in a very powerful way. I mean, over the last 3 years, we've seen an increase in poverty among older adults
Mhm.
using the supplemental poverty measure, which is designed specifically to take into account the nuances related to healthcare costs as we age. We now have 15% of our older adults falling below that poverty line.
Mm.
You look at the cost of living adjustment that was made available for Social Security this year, large percentages of older adults that rely on Social Security for the majority of their income in old age. That cost of living adjustment for some beneficiaries was eaten up by the Medicare premium increase alone. So the intersection between one's income and the healthcare costs is real as we age. The bottom line is Medicare is not free. There are real costs in terms of
Yep.
premiums, copays, out of pocket, as well as prescription drugs. And although Social Security is the greatest anti-poverty program we have out there, and it lifts millions, tens of millions of older adults out of poverty every year, its purchasing power is getting eroded by the ever rising cost of healthcare, and
Mhm.
that includes Medicare. So when we look at the poverty numbers and we see for the third year in a row, older adults were the only demographic cohort to see an increase, we know we need to make a change there. Now, at NCOA, we prefer an alternative measure to poverty and deprivation. We prefer a tool we call the Elder Index, which looks at the true cost of aging in America. Again, designed by our partners at UMass Boston's Gerontology Institute. It takes existing federal and state data sets and aggregates them into a market basket of goods: housing costs, healthcare costs, food, transportation, other basics. It actually looks at your health status, it looks at your housing status, it's localized by county, and it tabulates the true cost of aging,
Mhm.
which is about 30,000 nationwide.
Mhm.
And when you contrast that with the typical Social Security benefit, which is about 24,000, you see there's a gap.
Yeah.
There's a gap. It's not, it's no one's fault they can't make ends meet as they age. It's virtually impossible. But the good news is, and a lot of our work is focused on trying to help close the gap.
Yep.
And there are real programs like the Medicare Savings Program that will help with the cost of Medicare premiums, copays, and out of pockets, and the Medicare Part D Extra Help Program that will help with the cost of prescription drugs. Unfortunately, most older adults don't know about these programs. They're
Yeah.
eligible but not enrolled. So we need to help get the word out.
Right. Absolutely. Tell us a bit more, because you're touching on some important policy points, and we've got a broad audience who listens to this podcast. We've got folks who work in governmental public health, folks who work in health plans, folks who work in health systems. But talk to us a bit about the challenges specifically around Medicare, right, and kind of what that covers for the population and their health care, and then maybe touching on Medicaid a little bit and kind of how that kind of fits into it, and the kind of cost of aging as well. And I really want you to get at, so folks really understand cost of healthcare, cost of long-term care, for a moment. And again, I know you're an expert at this stuff. So
Sure. Well, what's powerful is when people have the aha moment, they may be navigating Medicare enrollment themselves, or they may be helping a loved one enroll in Medicare.
yep,
And first and foremost, there's a lot of choice. There's a lot of decision support that you need in order to enroll in the right plan for you. That stretches your limited dollars, that gets you the best health security. But the big aha moment is Medicare is not free. There are
mhm,
many costs related to Medicare, and they add up very quickly. As a matter of fact, the Elder Index demonstrates that typical health security costs $400 to $500 a month for
yep,
a Medicare beneficiary a
yep,
month. So that's a huge aha moment. And then there are other aha moments about whether it covers dental or hearing or eyes. And that also is a surprise and an unplanned additional
yep,
expense for most when they recognize Medicare doesn't cover it. And then about half of us will eventually need long term care, long term services and supports to maintain a quality of life and an independence. Medicare doesn't cover that either.
yep,
For those that are income eligible, they may be able to benefit from Medicaid, but it has a very low income threshold that you need to meet first and foremost. And Medicaid has a bias toward institutional or nursing home care.
yep,
And most of us don't want to go to a nursing home. We'd much prefer to age in our own home, to access home and community based services. They're also far more economical. But the reality is, Medicaid dollars are limited and will become more so in the coming years, given some recent policy changes. And with that institutional bias toward nursing home care, we're very concerned that states will default to nursing home and institutional care. So we've actually been doing a great deal of advocacy to try to encourage advocates, caregivers, older
yeah.
adults themselves to engage their governors and their state legislatures in holding the line on some of the advancements we've had in the last several years that expands Medicaid to cover home and community-based services.
Thank you for touching on that. I think it's so important. And also, again, going back to my practice of emergency medicine, we see so many times that individuals, they stay in the hospital, they stay in the ER even sometimes for days, because we can't find an appropriate placement, if you will, for that individual, or there's some place and they can't go back for whatever reason. Maybe they have a medical device that that particular location can't take care of. Can you talk a bit about the current landscape of long-term care and home and community-based services. Are there enough services that people want, and kind of what are some of the policy or funding challenges in that space?
Well, for decades, advocates have been trying to bring attention to the fact that this is a frontier of aging that needs to be addressed. Again, more than half of us will need long term services and supports, and we don't have a robust social insurance approach in order to ensure individuals have access to services when they need them. And it's only becoming more challenging with the demographics of individuals living longer and ultimately needing these services, and some of the government vehicles to support them, such as Medicaid, getting cut. It's just a very challenging set of
Mhm.
perfect storm like events. We already had significant waiting lists for Medicaid, home and community based services. And now we're looking at trillions of dollars in cuts to Medicaid, and states having to make difficult decisions in terms of what those remaining Medicaid dollars can cover in respect to a variety of populations that are very much so in need. One opportunity I see is that there is an increased awareness among caregivers
Yep.
that are self identifying as caregivers, that their ability to access care has implications for their own work life, and their employers are starting to recognize that as well. So we do see this growing recognition of the need for caregivers and care providers to be able to support our aging population. As a matter of fact, there are over 63 million caregivers that self identify, and increasingly younger generations are being called to care for their older, frailer loved ones or their partners or other family members living with disabilities. And so there's this growing awareness and public sentiment that we need to do better and we need to do something differently. I'm heartened by new proposals that policymakers are discussing, like the WISH Act, which it's bipartisan. It would create a catastrophic long-term care insurance program that would be administered by the government. It wouldn't cover all the costs, but it would begin to layer in a social insurance program more broadly beyond Medicaid. There are also real proposals and conversations about caregiver tax credits, just thousands of dollars, which would be a good start, but certainly wouldn't address the true cost of caregiving and covering services. But there is an increased awareness that we need to do better.
And thank you for touching on the importance and significance of caregivers, because what you're also talking about, it's not just the monetary financial cost. There's also a mental cost. I've seen this play out in my own family with aging loved ones. It is a lot, and we need to definitely support our caregivers. Um, what do you think? Next question. What do you think the role of the private sector is, and public-private partnerships in particular, in driving innovation in healthy aging and longevity over the next several years?
Well, I think to really embrace the opportunity that is longevity and aging, and I do think it's an opportunity. If we get it right, if we modernize our public policies, if we expand the public policies that work, there's a real gift that comes with the wisdom and the experience of aging. And when that can be brought to bear on communities in intergenerational ways, it's just amazing. So I see aging and longevity as an absolute opportunity that requires multi-sector collaboration. We need those public-private partnerships to further innovate. We need the continued advancements around medical and technological innovation. And we need to make sure they're available, accessible, available, affordable innovations ultimately. I mean, I see a lot of venture capital going into hot topics like radical life extension, allowing people to live longer and longer and healthier. But without the proper oversight, governance, and democratization of access to those innovations, those disparities we talked about earlier, they could just grow wider and wider. So I think it's really important that there is that public-private innovation, and there's also a role for government as well.
Yeah, yeah. Thank you for that. What do you think has been the most significant policy win for older adults over the past several years?
Well, aging is not a partisan issue, and we've seen that play out over the decades, and in particular in the last couple years, we've seen it play out. We've always worked hard to ensure aging was a nonpartisan issue and applaud the bipartisanship that's been possible. So when I think about the last several years, I think about the American Rescue Plan of 2021 and what was possible when we could get advocates weighing in with stories to share the importance of extending pandemic relief funding for community based organizations deeply rooted in neighborhoods and communities that were impacted by the pandemic. And we got over $1.4 billion allocated to the network. It was life saving. It provided access to critical services and supports that kept people safe during the pandemic. I think about the Inflation Reduction Act and some of the historic changes that were made in terms of capping prescription drug costs and the insulin cap and allowing Medicare to negotiate drug prices, really strengthening access to prescription drugs for all older Americans. And there were some provisions in there, in particular, that strengthened assistance for low income beneficiaries by expanding that Medicare savings program from a partial subsidy to a full subsidy, providing even more relief, making Medicare even more affordable. And then more recently, there's been some real bipartisan activity around the recognition of obesity as a chronic condition and the recent action by the administration to tackle obesity by capping the price of GLP-1s and extending access under Medicare and Medicaid is a big policy win in terms of being able to address chronic diseases better. So there are some interesting examples in the last few years. I'd say there's still a lot of work to be done given demographic trends. All the programs all of us rely on, Social Security, Medicare, Medicaid, Older Americans Act, really need to be expanded significantly to meet the demographic demands.
Absolutely. You've been such a great, and NCOA has been such a great advocate for the aging population for, like you said, 75 years. What do you think needs to be done? And do you think there is enough public engagement and awareness and understanding of how important this demographic is? Like, what can we do to make sure people really understand and can be champions for this work?
Well, I think it goes back to what you said early on. We're all aging, and we need to identify as such. We're all aging. It's about all of us. It's about ensuring all ages and all life stages are lived on our own terms with the right support and resources that allow us to live well, to age well, ultimately. Because when we really reflect on the current system, it's a DIY, it's a do it yourself experience. And that gets really challenging when the inevitable, unexpected issue arises, whether it's a job transition or a job loss, a relationship transition, or a loved one loss, whether it's a health issue. I mean, there are some key life moments that are not if, but when they hit and
Right.
how we navigate them. And right now, we're largely on our own to navigate them. And it depends on the resources, it depends on your social circle. But we all of us need to be empowered to navigate these inevitable uncertainties, and we need to have the circles of support around us in our communities that allow us to be more resilient. And so I think what we need to do is continue to raise awareness that these are not isolated
Yep.
issues, that we're not on our own. It's actually a uniquely human experience to age and to provide care, to receive care, and that we all deserve to have the systems and supports and policies that allow us to age and live as well as possible. So I think there are opportunities for us to update the social contract. There are opportunities for us to update and expand all the programs that all of us rely upon to age well. And we
Yep.
see younger and younger generations recognize that we need to make some changes and we need to make the changes quickly, given they're likely to live even longer than their parents and grandparents.
That's right. That's right. It's so important. Last question. what is one actionable tip, practical resource, piece of advice you would give to our listeners who are really striving to support the aging population? What should they do? If there's one thing they could do, what would it be?
Be vocal, be an advocate, be local for the legislation and the public policies that fund the programs that ensure that all of us can age well, and get connected to the programs and the policies. So in every state, there's a state unit on aging, and
Yep.
they are in the lead for all the planning and all the coordination statewide. And they work with a network of area agencies on aging. There are over 630 area agencies on aging. So there's coverage across the whole United States when it comes to accessing an organization that is being really thoughtful about planning and coordinating services in their jurisdiction. So the one thing, if there's only one thing you can do, be vocal and be an advocate for the legislation and the policies that ensure all of us age well, and get connected to that network of organizations so that you can be working together. There's a great resource, Elder Locator, that can identify your local area agency on aging and all the other community and faith-based organizations providing aging services in your jurisdiction. Great resource to be able to begin to have those conversations with those organizations and become partners.
Thank you so much. Such great words of wisdom as always. We'll make sure Elder Locator is in our show notes as well. Ramsey, thank you so much for being on our show. Again, just so grateful for your advocacy and your leadership. Our country needs you. And so just thank you for your words of wisdom today.
Well, thank you, Joneigh. A pure pleasure.